Last time, we discussed the concept of a multidisciplinary team approach. Expanding the umbrella of care means bringing together a fantastic cast of specialists who collaborate like a well-rehearsed orchestra, minus the tuxedos. This teamwork helps tackle complex treatment decisions and provides comprehensive support to patients and their families. After all, who doesn't need a team of superheroes in their corner? Understanding the oncology umbrella of care. The oncology umbrella of care is like a cozy blanket that covers all aspects of cancer treatment, integrating various elements of patient care. This model is designed to support patients throughout their cancer journey, and it typically includes diagnosis and treatment. These utilize advanced imaging and pathology, along with treatment modalities like chemotherapy, radiation therapy, and surgery. Think of it as the detective work and action scenes in a medical drama. Support services. They offer psychological support, nutritional counseling, pain management, and palliative care to meet both physical and emotional needs, because we all know that laughter and good food is the best medicine. Patient education empowers patients with information about the disease, treatment options, side effects, and lifestyle modifications. Knowledge is power, and we want our patients to feel like superheroes. Survivorship care focuses on follow-up care and monitoring after treatment, including managing late effects and promoting a healthy lifestyle. It's all about making sure the adventure doesn't end. Interdisciplinary collaboration. A team of specialists, including oncologists, nurses, social workers, and pharmacists, work together to create individualized care plans. Think of it as assembling the Avengers for your health. Goals of the comprehensive model. By adopting this model, oncology care aims to improve patient outcomes, because who doesn't want a happy ending? Enhance quality of life. Let's add a little sparkle to the journey. Support patients and their families throughout the cancer experience, because no one should face this alone. Example treatment plan. Now remember, this treatment plan is tailor-made for me, Nemz, my particular plan. Everyone will have their own individual plan, so please keep that in mind. After meeting with the new medical oncologist at the Donald Gordon Medical Center, my treatment plan is set for the next year and is quite intense. Let's just say it's not for the faint of heart. These are my treatment details. Immunotherapy. This will be 17 cycles, which is every 3 weeks. Chemotherapy. There are 2 parts. Part 1 will be for 12 weeks and will be weekly. Part 2 includes what is known as the Red Devil chemotherapy, or doxorubicin, adriamycin, can never say this, commonly known as the Red Devil. However, nurses tell me we're changing the name to the Red Angel. This will be given every 3 weeks for 4 cycles. The goal is for the chemotherapy and immunotherapy to shrink the tumor enough for removal during a lumpectomy. This leads us to the surgery. The lumpectomy will involve removing the tumor, surrounding tissue, and any affected lymph nodes. It's like decluttering a very unwanted guest from my body. After a healing period of 6 weeks, I will undergo radiotherapy on the tumor site to zap any leftover cancer cells because we want to make sure they don't throw another surprise party and come back. On a personal note, I will be staying in South Africa for the next 6 months. This journey might be long and challenging, but I know it's worth it compared to other plans we considered. After all, every great story has its ups and downs, right? After the 6 months, I will continue any further treatment back home in Zambia. Here's my chance to say once again, thank you so much for joining me on this adventure.
Right now, we're waiting to see an oncologist and to see what happens about the chemo. So, yeah, we'll keep you posted.
Rachel and I met with my medical oncologist, Dr. S.D. Moodley. He was both informative and kind. He developed a treatment plan that would span a year, and we were set to begin treatment in 2 days. We were also directed to his team, who were very helpful with the preparations for both chemotherapy and immunotherapy. So yes, we've got the treatment plan and it's long. It's hectic. It is basically for the next year. They've got me a schedule. At first, I do immunotherapy every 3 weeks for 17 doses. That makes a year. And then I do the first 12 weeks every week. I do chemo. And then I do another 4 sessions every 3 weeks. And yes, it is the Red Devil.
So the last cycle.
The chemo, the one that everyone is scared of. Yes, that's on the last cycle. The Red Devil. Yeah. So, gotta go home, take it in. Hopefully we'll start this week.
Yeah.
On Thursday. And she just said, look, it's only 2 hours, or maybe 3 at most.
Yeah.
And it's intravenous. I can never say that word, which is a drip. So it's really interesting that we're starting this journey so soon.
Yeah.
We'll keep you posted.
Yeah. And they were very the bit what's the word?
Informative and
Yeah, very informative and relaxed. They're not too strict on the diet. They say eat what you can, so they don't even recommend diets. So which is a good thing to know.
And they're really, really nice. They've given us their number in case of anything, especially for Rachel. If any side effects, they're not going to give us a lot of meds for her to give me because they say that
they give as they go.
And
as she feels whatever symptoms side effects she experiences is when they give.
Because every medicine that they give you will also have its own side effects, so they don't want to load me with like a lot of medicine. So yeah.
People, it's cold.
It's cold.
Just in case you see us dancing, it's cold.
It's cold. Good morning. Just a heads up. Good morning. Just a heads up. Rachel is feeding me fruits and vegetables. Help me, somebody. Now I've had all the fruits and vegetables from the rainbow. I've had grapes, which is purple. I've had celery, which is green from vegetables. I've had lemons, which is yellow. I've had oranges, which is orange. I've had blueberries. I've had, what else? I've had, name it. I've had the berries. I've had fruits. I've had the vegetables. Whew. Yeah, we're just getting ready for the chemo tomorrow. And yeah, so
We're preparing, and I'm going to have my multivitamins soon. And yeah, so every morning I have all the fruits and vegetables I need, so that at least it gives me that strength. Yeah, so that's the story for today. So right now I'm on my way to do my eyebrows in case they fall off. So I'm doing some eyebrow. It's called ombre, which is like tinting, not microblading, but tinting. So yeah. So let's see. In case they fall off, I still want to look a bit normal. So that's yeah, that's the agenda for today. Before I have the I start the chemo, which is due which is due to begin tomorrow. But we'll keep you informed. Yeah. So he just showed me a new needle for shading. And where is it? Where are you? Yeah, so it's more or less like a tattoo. If anyone has ever had a tattoo. Now he's gonna shade using ink, right? Pigment, yeah. Using pigment, and then yeah, let's see. As you can see, he's done the shaping, and yeah, and you can see my hair, my real eyebrows underneath, and yeah, let's see how it turns out. And this is the final product. Wow, eyebrows are still numb, but you've done such a good job. Thank you. I'll be back in 6 weeks for a retouch. That's towards the end of July. Yeah, so that's what a brow ombre is. Good morning. It's D-Day. I'm looking at my eyebrows. I really should have done these last week and not yesterday, because they are painful today and look very dark, as you can see. But anyway, I guess it's all part of the journey. Yeah. So I woke up this morning feeling, of course, grateful to wake up, and quite confused, but certain at the same time. I'm certain that God's got me. I know. I'm certain of my wonderful support system. I'm certain of the strength that God will give me, and I'm certain that I want to continue living a good, happy life. So as I go into my treatment today, I'm definitely looking forward to coming out on the other side, and I know I will come out on the other side strong. I know that this is a life-changing journey for me, and the love of my family, friends, and of course my 3 boys, who I love to death, will keep me going strong. I'm also very grateful for SCS assistance, funny enough, because I have seen them push through for me. I've seen them, rally. I've seen them fight for me to have the best treatment. My ladies, Dr. Ndulo, Nora, Chanda, and of course, my nonku, who has been there every day fighting for me, and and I'm also very grateful to my sister, you can see over there in bed. She's equal, feeling the same way. We woke up, we were singing and dancing to Gyre, I can never say it. Is it Gyre or Gyra? Gyra. By Elevation, what? Elevation Worship, and it just hit,
it was just right there. Yeah. I'm grateful to the many phone calls I've had this morning from my loved ones. And yeah, of course, they made me cry, and that's why I'm crying. And then I can't, of course, cry too much because the tears have salt in them and they're going on my eyebrows. And the pain, it's unexplainable. But yeah, I'm not allowed to put any water on my eyebrows for the next 3-4 days, so you can imagine. What else can I say? Yeah, as I go into this treatment, I think overall I'm excited because I'm finally getting to do something about this, about this cancer. And yeah, I just want to say I love you all, and let's see how it goes. And this is the beginning of a new journey. So the next year will be interesting. Well, peace in the Middle East. Love ya.
So my second in command, Abigail, has come. Huh? She has to feature before I go. Abby, those eyebrows. You see, this is your fault. Can you see?
But you're looking good.
Yeah.
You're looking
Anyway.
good.
So Abby's here to see me. Oh, I'm scared, my friend. I'm scared.
Nah,
What
you'll
can
be
I do?
fine.
Hanyambezi le Sawachikuku. We thank God for the great success in the treatment. Let the joy of the Lord continue to be your strength as you continue on with this treatment. All the best, and that the goodness of God continue to be with you. God bless.